Well, it's a great area because it's time for our interview right here in the studio. I am going to be talking today to one of our supporters, one of our community members who is doing great out there, getting the information out there to our seniors and very important information. And I am talking about Kaushi Shah. And if you ever have any Medicare questions, Kaushi Shah is the person you want to call. Good morning and welcome to Namaste Radio, Kaushi.
Good morning, Manishka. Namaste ji. How are you all?
Everybody out here is doing good. How is your Saturday morning going?
Saturday is good. It rained quite a bit in our part of the town, but everything's looking okay. Sun is out, so no complaints so far.
Absolutely. As long as the sun is out the next day, it's all good.
All good, right? Yeah.
So, Kaushi, firstly, I want to thank you for your support to Namaste Radio, and we are so happy to have you on board on Namaste Radio.
Thank you. Thank you so much for having me. I'm so glad we connected. Thank you for all your support, for the e-blast and the interview. I really appreciate what you're doing for me.
Absolutely. Absolutely. It's our pleasure. And what you are doing is one of the very important parts of our life because, you know, we all get to that part. We all need it. And it's very important. So we are talking about Medicare. And, you know, you helping people out there to understand it, to know it is one of the most amazing things that I can talk about today. And tell us to start with, what is Medicare?
So I love what I do. And, you know, I'm crazy about it. I love to help people. I've always helped in the community with our local temple and things like that. And just being blessed to have a career that I love, love to support our community and Medicare, especially to our vulnerable population, people elderly, people that are 65 and older, certain young people with disability. So it's a great pleasure and great opportunity for me to get into this field and be able to help those that really needs it. Medicare is very confusing. It's confusing for people that are working and then knows a little bit about insurance or so-called internet savvy. It's still so confusing. So, Medicare is for health. It's a federal health insurance for people turning 65 or younger with certain disabilities. If you have Medicare, please give me a call. I can help you. I can guide you things. But it is a federal health insurance for elderly.
Absolutely. And that's why I said we all will get there one day. People are already there, So I have, my parents here. So I know how important Medicare is and how important it is to know about it. And in advance, you want to know about it. You want to understand what it is so that you don't put it all the way till the last part. And
Exactly.
Then you're struggling. So knowing the right person, person to guide you through it is important. And that's why we have Kaushi Shah today talking to us. And we will be talking to her more going forward. But now moving forward here, you did tell us about what Medicare is. But, and like I said, it is very confusing for people like me also. So what are the 4 parts of Medicare?
Yeah, so when people get Medicare, or like you said, when they get closer to the age, they start learning about it or listening and kind of hear the TV advertisement or newspaper or some kind of flyers like, Medicare Part A, B, C, D, what is all this? So basically, I just want to kind of go over in a nutshell. I know we don't have that much time, but I am doing a seminar on June 10.
Okay.
It is on our Facebook, so please connect. I'll go more in detail on the presentation. But basically, your Medicare part, it comes with 4 parts. There's Part A, B, C, and D. Medicare has the traditional Medicare comes with Part A and B. A is usually your hospital. B is your usually medical expense. So like in the event you'll be hospitalized, they'll help pay for the Medicare. They'll help pay for the hospital stay.
Mm-hmm.
Part B is like your doctor's visit, your outpatient procedures, and things like that. So people turning 65, they pretty much get Medicare A and B if they have worked, 10 years and accumulated 40 quarters hours. I mean, there's different rules to it.
Got it.
But your traditional Medicare, it looks like it's red, white, and blue paper card.
Mm-hmm.
It'll have your Part A, which is a hospital stay. It'll have your Part B, which is your medical expense, and that's your traditional Medicare. And then you add other parts to it, such as Part C, Part D, or a supplement or Medigap policy. And these are the confusion stage that, what is all this A, B, C, D? What do I have to have? Do I have to have A, B? Or if I have A and B, am I done? Do I need more? So it's kind of like there's basic 4 parts to it, and we just kind of have to put it all together to make it complete. So, you're kind of getting taken care of in your healthcare needs with all your A, B, and then if you do C or D with all your medicines as well as your medical expense.
Absolutely. A lot of, details out there. Thank you for sharing that, Kaushi. One thing which, I've like I said, I have parents at that age, and I saw a process for them. And I can't emphasize how confusing it can get at the last minute. So what is the process to apply for Medicare, and how soon can you apply? We know, okay, I'm turning 65 next year. So when can you apply for that?
Yeah, and like you said, you said it right, exactly on the target. It is very confusing, even like yourself. If you're helping your parents, you probably saw the website, mm-hmm. and it's pretty confusing. So to apply for Medicare, of course, you can call Social Security, which if someone they probably know it's a long hold and the phone gets disconnected. Unfortunately, we're not open. The Social Security office is not completely open just yet. You have to have an appointment, and then only you can go. So that makes it tough. So basically, you can apply online, mm-hmm. or call me. There is no consultation fee for me to apply for your Medicare.
Wonderful.
I'll walk you through on how to apply for it, so that way you'll know it's done right. Also, the process is kind of a lengthy process, and it's actually taking a little bit longer at this moment, mm-hmm. because of the COVID, and not all the employers are working from the office and stuff. So basically, the rule of the thumb is when you're turning 65, you can apply 3 months before your birthday, mm-hmm. the month of your birthday, or the 3 months after your birthday month. So you kind of have that 7-month period, okay. And you can apply online or call me. I say, please call me. Mm-hmm. You're not losing anything. I'm not charging you anything. You're not losing your benefits, or it's not getting cut from your Social Security benefits or your Medicare benefits. It's an asset when you call an agent, because they know they do this in and out every day. They know how to apply. And I've applied for my client, and I know everything's right. And they received a letter that, thank you, we received your application. And their date of birth is in July. We're almost in June. They haven't received anything after that. Mm-hmm. Usually there's a procedure that send naturalization mm-hmm. form if they've been citizen that way, or different things that they have to send. Mm-hmm. And none of those papers have come for my clients. And some have, and some haven't, Right. So it's just a waiting game. So imagine if you did this by yourself. First, you don't know who to contact. Second, you don't know if you did it right or wrong. And it's just kind of like, waiting games. At least if you have someone like me that can look into it and say, at least we did it right. It's taking time. Let's wait, or let's do some approach. Like I guided my client yesterday to call her local Social Security office and see if there is any answers their way. So there's different avenue that you can have once you have an agent, and it is very confusing. So please call me, Arsha. Call any of your agent. My service is completely free. I'll help you guide on when to apply. Once you have Medicare, we'll also go over in detail if you're going to be working, if you should carry on with your work or employer's coverage, or if you want to go with Medicare, or whatever insurance you have will make sense, and we'll let you know which one is better for you cost-wise and care-wise.
Absolutely. Thank you so much. And it is overwhelming. So definitely you want to call Kaushi Shah. If I may say, she's the doctor of Medicare, so you want to go through the right physician to get to it, So when you have an expert, it makes life so much easy. So definitely do that. Everybody listening out there, and you can be young, you can do this for your elders in the house, or just for your knowledge. Call her. The consultation is free, so definitely.
Everything is free. The consultation, helping you apply for Medicare. Once you receive Medicare, if you want to go with Part C or if you want to go with Medicare policy or your employer's insurance, we have no problem with whichever route you want to go. We want to help you choose the best route that's for you. And like I said, that's going to benefit you financially, where you don't have a lot of monthly premium or co-payments or things like that, as well as your health care. And kind of explain you, if you do this is what your co-payment is or your deductible is, and kind of guide you through everything without any cost to you. I mean, you have nothing to lose but to gain the knowledge and have somebody on your side. Touch wood, I have very good clients. They're patient with me. They've seen my work, and they know I'm there. Every time they call, I answer the phone calls. I help them. So yes, please call me. I'll help you apply for Medicare. I'll also help you in terms of Part C or Medicare policy, or like I said, even employer's insurance, whichever one you decide. Whatever works for you works for us.
Absolutely. Thank you so much, Kaushi, for talking with us today. I know you will be back very soon in studio with us. So I look forward to talking to you there much more in detail. But before you go, please give out your number so that they know exactly where to call.
Yes. Please call me. My phone number is 832-282-3515. And one more last thing I want to add. I am doing a seminar. It's a live presentation or Zoom. It's on June 10th. Please call me or email me or text me. I can send you the link or the invite if you want to come learn about Medicare or have some questions or whatever. It's free. There's no cost. It is on June 10th. I have two seminars. One is at 10 o'clock in the morning and the other one's at 1:30. Whatever suits your time, please give me a call. My number here is 832-282-3515.
Absolutely. That is Kaushi Shah for your retirement solutions, Medicare. Call her. She is the right person to guide you through the process, to help you. And the best part is to get started with attending that seminar. So call her 832-282-3515. Thank you so much, Kaushi. I look forward to seeing you in studio very, very soon.
Absolutely. It was very, very nice speaking with you. Thank you so much for taking me on air, and I can't wait to meet you and connect with you again.
Same here. Have a good weekend and, stay safe out there.
Yes, everybody have a great weekend. Be safe. Thank you.
Thank you. Bye-bye. That was Kaushi Shah, the Medicare agent that you want to call for all your, retirement requirements. Again, 832-282-3515.